Minoxidil has been a widely recognized treatment for androgenetic alopecia for decades now. There's no debate about this. However, its efficacy as a hair growth stimulant varies among individuals, partially due to the differences in the activity of the sulfur-transferase enzyme in the body and more so with topical minoxidil, the scalp. The sulfur-transferase enzyme is responsible for converting minoxidil into its active form, minoxidil sulfate. The study titled, quote, Minoxidil Sulfur Transferase, a marker of human keratinocyte differentiation, published by Gerald A. Johnson et al. In 1992 for the Upjohn Company, established minoxidil sulfate to be the driver of hair growth. And there are also studies that show things like topical retinoids like tretinoin, which boosts sulfur-transferase activity on the skin and scalp, being shown to boost minoxidil efficacy for non-responders and also responders alike. I'll leave some of the studies in the description of this video for your reading pleasure, but two studies are of interest although they may have small sample sizes. One study titled, quote, Topical Tretinoin for Hair Growth, unquote, published in 1986 by G.S. Bazzano et al. In the Journal of the American Academy of Dermatology, with a sample size of 56 subjects, and Study 2, titled, quote, Efficacy 5% minoxidil versus combined 5% minoxidil and 0.01% tretinoin for male pattern hair loss, end quote, with a sample size of 31 male subjects, also came to a similar conclusion. These studies, along with others, show the importance of the sulfur-transferase activity because it is minoxidil sulfate that grows hair. If you don't have any of this sulfur-transferase enzyme in your scalp, it will not be effective. In fact, low-dose daily aspirin has been found to reduce topical minoxidil efficacy, as seen in A. Gorin et al.'s 2018 study. Although this study has a low sample size as well, it's still important to consider the possibility of medications reducing sulfur-transferase activity. For this reason, a minoxidil sulfate product would do wonders as it is pre-compounded with the active metabolite that will grow hair. However, there are some difficulties to this endeavor. Topical minoxidil sulfate has several difficulties related to its formulation, stability, and absorption. Stability. Minoxidil sulfate is highly unstable in both aqueous and alcohol-based solutions, with a shelf life of only around 6 hours or so. So this instability can limit its pharmaceutical use, therapeutical effectiveness, and shelf life. Absorption. Minoxidil sulfate has a higher molecular weight, about 283.3 grams per mole, compared to minoxidil's 209.3 grams per mole, which may reduce its absorption into the scalp. Molecular weight is a determinant factor for the degree of transcutaneous penetration, and the higher molecular weight of minoxidil sulfate could present a possible challenge for its effectiveness as a topical treatment. Formulation challenges. Developing an effective minoxidil sulfate-based topical formulation that overcomes the stability and absorption issues requires further research and experimentation. Identifying appropriate carrier solutions that can maintain minoxidil sulfate stability while enhancing transcutaneous absorption is very crucial. But there are potential solutions to the stability and formulation challenges faced by topical minoxidil sulfate. I've done some research here and there for this. So, some encapsulation techniques. Minoxidil sulfate could be encapsulated within liposomes, nanoparticles, or other advanced drug delivery systems to protect from degradation, improve stability, and increase its residence time on the scalp. There's also a look for alternative solvents, so we could explore the use of non-aqueous or non-alcoholic solvents with better stabilizing properties for minoxidil sulfate, and this could lead to improved formulations. Now, taking this into account, optimizing pH is another factor. Adjusting the pH of the formulation might help enhance the stability of minoxidil sulfate in the topical solution. And finally, the topical minoxidil sulfate may be combined with stabilizing agents, such as antioxidants or chelating agents, which can help protect the compound from degradation and improve its overall stability. Regarding absorption, the Dalton Rule states that substances with a molecular weight below 500 Daltons are more likely to penetrate the skin. Now, the molecular weight of minoxidil sulfate is 289.3 grams per mole, is well within this range, suggesting that it should be capable of penetrating the skin barrier. This rule supports the notion that higher molecular weight of minoxidil sulfate compared to minoxidil might not pose a significant barrier of transcutaneous absorption. However, it is essential to consider other factors such as lipophilicity, and lipophilicity refers to the ability of a chemical compound to dissolve in fats, oils, lipids, and non-polar solvents. So pretty much the scalp, because there's a lot of sebum and skin just is made up of these oils. So when it comes to a topical solution, there needs to be a degree of lipophilicity for the compound to actually go through the skin because of all these fats that are present on the skin itself and just the general overall structure of skin. But also the choice of carrier for this solution has to be able to accomplish this as well. So further research is needed to develop optimal formulations that take into account these factors and improve the absorption and efficacy of topical minoxidil sulfate for hair growth promotion. Now, I also want to circle back a bit on methods of encapsulation when it comes to minoxidil sulfate. I find this to be potentially the path in which researchers could take if they would want to make a more effective topical minoxidil derivative solution like a topical minoxidil sulfate product. So encapsulation techniques involve enclosing a compound such as minoxidil sulfate with a carrier material to protect it from degradation, improve its stability, and enhance its delivery to the target site. Some possible encapsulation techniques for topical minoxidil sulfate formulations include liposomes. So liposomes are small spherical vesicles composed of phospholipid bilayers. Minoxidil sulfate could be encapsulated within liposomes to protect it from degradation and facilitate its penetration into the skin. This circles back to the lipophilicity that I was talking about before. The liposomal formulation would merge with the lipid-rich outer layers of the skin, releasing minoxidil sulfate directly into the target site, so the hair follicles. This approach could be improved by the bioavailability and efficacy of minoxidil sulfate while minimizing potential side effects. Next are just other nanoparticles. So minoxidil sulfate could be encapsulated within biodegradable nanoparticles made from materials like polymers, lipids, or proteins. These nanoparticles could protect minoxidil sulfate from degradation and improve its stability and shelf life. The small size of nanoparticles would allow for them to penetrate the skin more effectively and release minoxidil sulfate into the hair follicles. Additionally, the controlled release of minoxidil sulfate from the nanoparticles could help maintain a consistent concentration of the active compound on the scalp. Microemulsions are thermodynamically stable, isotropic mixtures of oil, water, and surfactant. Minoxidil sulfate could be incorporated into a microemulsion system, which could help protect the compound from degradation and enhance its solubility. The small droplet size of microemulsion would facilitate the penetration of minoxidil sulfate into the skin and improve its absorption. Finally, hydrogels. Hydrogels are three-dimensional cross-linked polymer networks that can absorb large amounts of water or biological fluids. Minoxidil sulfate could be incorporated into a hydrogel matrix, which could protect the compound from degradation and provide a sustained release of the active ingredient, being minoxidil sulfate itself. The hydrogel could also enhance the contact between minoxidil sulfate and the skin, thus improving its absorption going into the hair follicles. So really, I think that stability is the major issue rather than absorption. Just my opinion, because we kind of have to get over that short shelf life. Also, once minoxidil sulfate is compounded, it likes to go back into being just regular minoxidil. And that's not really good for people who aren't responding well to minoxidil because they may not have enough of the sulfur transferase enzyme on their scalp, which could turn minoxidil into minoxidil sulfate. So really solving this issue by making minoxidil turn into minoxidil sulfate and having it have an extremely stable shelf life is the most preferable thing that we can do. But there are other things, like Minoxidil Max's website. They have this particular product called Dual Gen 15, which includes azelaic acid and retinol, along with minoxidil, and retinol has been shown to help boost sulfur transferase enzyme activity So if you have that, put that on your scalp along with minoxidil. If it's boosting the sulfur transferase activity on your scalp, this can potentially turn a non-responder into a responder for minoxidil. So that's really nice. But again, you would have to be using that same product that has the retinol with minoxidil so you can actually get those benefits. Because genetically, you may not be the person that has high sulfur transferase or average sulfur transferase activity on your scalp. So that's something to take into consideration. Now, before this video ends, I would like to thank Dr. Pedro Colli, Rocher Diaz, and colleagues for their article titled, quote, Use of Minoxidil Sulfate versus Minoxidil Base in Androgenetic Alopecia Treatments, Friend or Foe, unquote. The comprehensive analysis of the differences between minoxidil sulfate and the minoxidil base in the treatment of androgenetic alopecia has been incredibly valuable for understanding the potential benefits and challenges associated with the use of a topical minoxidil sulfate product. Their work sheds light on the factors that influence the efficacy of these formulations, including stability, molecular weight, and individual variations to sulfur transferase enzyme activity. So I thought it was a really good write-up, and it's just interesting to research these things. So anyway, that's pretty much it for this video. I'm about to graduate soon from college, and just thought I'd just put that in there. So thanks for watching, guys, and I hope to see you on the next video.
What can I say? Can I say, hey, it's 2022, bro.
Hey! Yeah!
Two cups.